Okay, now we're going to go over Module 7, and it's Module 7 in your book. This edition is page 51, providing basic care. A lot of need to know words, so when we're done, go back over these and see if you recognize those. The main objectives is to describe personal hygiene, methods of bathing, procedures for foot and nail care, oral care, hair care, and identify pressure points and pressure sores and demonstrate the use of bedpans and the different problems people have with digestion and bowel and bladder problems. Okay, so why do we do personal hygiene? It's important for maintaining health. Grooming enhances the person's self-esteem, but before you assist with this personal care, follow the procedures at the facility you're at or the assisted living facility, and always check the plan of care. So when you're going into someone's home, are you supposed to be doing that? Generally, bathing is a big part, and personal care is a big part of our job. And quite frankly, Chapter 7, Module 7, is a very important part of the day-to-day things you're going to be do. So we have like nicknames for things. We may say AM care was provided to the resident, or PM care was provided to the residents. Usually the elderly do not bathe every day, nor should they. However, AM care and PM care is washing your hands, your face, the armpits, and the perineal areas. So that's your private areas below the person's genital areas. And whenever we do any procedures, we're going to provide privacy, but especially these. Okay, so when we're doing skincare or cleaning someone, it's a great opportunity to check for pressure areas like redness, rashes, and any kind of skin issues. And then we're always going to encourage the person to do as much as they can. Okay, so there is a video in your module about cleaning the genitalia and rectum. But we're always going to clean the genitalia and rectum during a daily bath. And then, of course, after defecation, that's when they poop. That's another word for having a bowel movement or pooping or urination. And one of the things we're going to teach is always from front, we're going to wipe front to back. So why is cleaning the perineum so important? Because if it's not done correctly, we end up getting, the clients get urinary tract infections, better known as UTIs. So the infection starts from the urethra and it could travel up the bladder and into the kidneys. And if the kidneys have a bad infection, it could hurt them and put a person on dialysis. So right here, so let's look here, is this is a male genitalia, but the urethra, let me move it on my right, is the tube going up into the bladder. Okay, so the male, 7 inches, the female, 2 inches. That's why females, you think of any kind of tube going in or hole going in the body as a little railroad tracks that bacteria just love to thrive and go up. Okay, so if they get a bladder infection, then that's a urinary tract infection. But literally, it could keep going up those tubes, the ureters, and go into the kidneys. And a kidney infection is serious stuff. So we want to prevent any urinary tract infections, because then the patient ends up on antibiotics, and could be a problem for them. And every medicine has side effects. Okay, another thing that could happen if we don't do pericare or don't do it correctly. Let's look at this. This is someone's buttocks, right? And they've been wet and laying in that wet, and it could get excoriated and red like that. So as you can see, this is a different picture of a male excoriated area could lead to skin breakdown, which could lead to infection, and you could see it hurts. Okay, so let's go through pericare. This is one of the skills you'll have to demonstrate. And you want to gather all the equipment you want that you'll need. So bath blanket, That's a thicker blanket like this back here, but it could be just a big a towel, a wash basin, warm water, bed protector, because you don't want to have to change the linen if the linen is clean. So it's something that's waterproof. Soap, towels, and gloves. We're always going to wash our hands before we put on the gloves. Explain to the patient what you're going to do, or the resident or client what you're going to do. Provide privacy. We want to, if the bed is an adjustable bed where the height goes up, adjust it so it's more comfortable, and usually to our waist level is the best. And again, we're going to put that protective barrier under the resident's buttocks, and then cover them up with a bath blanket before we get started. Okay, so there we're going to use a washcloth and and this is for bathing, and you can make a mitt, and a mitt is when you fold it over like this, and it's in thirds. But part of it is so that everything doesn't, and tuck it under, doesn't dangle. However, the way I like to do it, and the way we teach in CNA, that seems to work really good, is just to fold uh, the washcloth in half and in half again. And then when we wipe, we are going to wipe and use a different part of the washcloth. So I'm going to do a female. I just have this is the female genitalia. So this is the labia, these folds of skin here. Um, and then here is the rectum. So there are other videos on this, but I just want to show with the words. We're going to wipe from front to back, right? And then I could change the area of the washcloth. Put this here. I would, of course, have gloves on. This is a clean area. It's a soapy washcloth. Wash front to back again. Switch it over. And a clean area again. Wash front to back again. Clean area. One more time, front to back again. And then you'd have to rinse, okay, and I prefer to rinse with a different washcloth. Um, so some tricks of bathing, you may have two wash basins, and one is for washing, so it could be soapy water, and then another one for rinsing, so it could be non-soapy water. These are inexpensive, and so that's one easy way to do it. However, washcloths are small, so even if you were the person doing the laundry, I'd rather use 10 washcloths than one or two towels versus three towels and three washcloths. Okay, so again, when you're rinsing, you would wash front to back the same way. And then we often will, grabbing pat, pat, pat dry, but always pat, pat, pat from front to back. All right, now let's go through the male. Here we have the male. And I just lost my washcloth. But we want to always bring everything away from the urethra. So we could wipe around the tip in a circular fashion, and then always going up using, I have two hands here, a different area of the washcloth, going away from the urethra, from the opening. Okay, so going away, tip it around, going away from the urethra. So some books say circular and then away. If they have a foreskin, you have to pull that back, and I can't demonstrate that on here. And then you have to pull it back forward after you're done cleaning in that area. Okay, so we're going to help the patient to a side lying position, which I did here. And we're going to use a clean washcloth and wash the rectal area again from front to back, just in case it's a female or a male. We want to take, because the rectum is considered dirty, we're going to go up the back, different area of the washcloth, up the back. Okay. And then when we're all done, we're going to rinse, pat dry, dispose of the linens, and the bed protector, which is this, and put all the supplies back in where and clean up the area. Okay, you remove your gloves, right? And I'm going to report anything unusual. When we're washing a client, any part of their body, the caregiver, you, must test the water first. Excuse. So if you're wearing gloves, which you probably will be, you could test the water with your elbow, which would be a good thing, if, especially if you're wearing scrubs or short sleeves. And then have the resident test it. Now, they could test it like this. However, if they can't reach into the bucket, give them a washcloth and let them feel it. Say, how's this feel to you? Touching their hand. Um, Okay, so there is a video for bed baths, so I'm just going to highlight some things. Always talk to the patient. Try to keep them covered up as much as possible, the door closed for privacy. Oh, I keep moving around. One of the things you want to get them undressed first. Just way before you even get the water, if it's a bed bath. This way the water doesn't get cold. Sometimes getting the pajamas off and everything is hard to do. You keep them covered with a bath blanket or some kind of blanket, but this way, once you get the water, you check it, they check it, um, and then you could put your gloves on. If you put your gloves on before, that's okay. We actually usually do that, but check it with your elbow and then have them check it. But if they're completely without clothes, then the bath goes quicker itself, and you keep them warm with a nice blanket. We're going to always begin with the eyes. We're going to work our way down. Okay, so begin with the eyes, working out, and you can watch the videos with that. And then we dry the towel, dry the area. So here's some once you when you're washing the face, if you put the towel, a small towel on their chest, then you could use this to dry their face and anything that wouldn't drip down. And then once we're always put soap on, always rinse. Then we're always going to put a towel underneath the arm. So if this was the patient's arm, we're going to put the towel underneath it to keep the bed dry. Wash, rinse, and dry. We're going to do one arm, the other arm. We are going to keep them, we have the blanket on. Now we're going to do their chest. So we need to put a towel over their chest, and then we could pick it up and go under to wash it, right? And I don't care if it's a male or female, then we could dry them with it. And then we could go down and do the abdomen. All right. If it ladies' breasts, you're going to have to look under those breasts because that's one place that patients get rashes. After we wash the abdomen, we're going to skip the peri area, which is what we showed. We're going to skip this area and we're going to go right down to the legs. We're going to wash the leg closest to us, then we're going to wash the other leg. At that point, we're going to change the water, then do the peri-care with clean washcloths, clean water. Always washing again, front to back. And one of the things, if you don't put the used washcloth in in the basin and have a few clean ones. Once they're turned and we're done doing the peri-care, we could wash their back after we've washed their buttocks. Okay. Um, okay. Okay, so for some of your patients, you may be giving them showers or baths, right? They may be in the home and showers in facilities. So just be careful because slips and falls happen on that wet floor. Again, safety test the water first, and a lot of them have a handheld shower. But before the patient gets in, make sure you test it and then put their hand in it to make sure it's okay. Always be there to get the patients in and out of the shower. Never leave them alone while bathing. Okay, big time for falls there. Okay, if you're giving showers, you might want to do some checklists. I don't care if you do them on your phone or do a checklist that is a pad if you carry it around, just so you make sure you have everything there, because that's not the one place you want to leave them. So do you have enough washcloths, towels? Is there soap, shampoo, conditioner, anything that you might need? Okay, because you don't want to leave them there. And I will show you some products that we may use in the shower that they could sit on, like shower chairs. Always, and this is often a question and a test, because we always want to encourage whatever they can do. And most people can wash their face. So you might be washing their face or that the patient may be washing their face and we're working on something else, maybe not their arms, but maybe their back, going from top to bottom. Okay. Um, and so just so you know, there is a special temperature. It's generally 105 degrees, right, that we want at the bath or the shower. Um, and if we can, and this is what, if you're doing home care or wherever you're working, say, hey, this doesn't seem safe. So someone, it doesn't have to be you, but you tell your supervisor so they could get a rubber mat or something to prevent slipping. Um, there's so many devices out there. Okay. And again, encourage everybody to do as much as they can for themselves. So after the bath, we're going to have to get them dressed and undressed. Again, so we're going to have to help people get dressed. One, they need to be able to pick out their own clothes. And we're going to help prepare it, get it ready for them, provide privacy, remove the clothing, starting with the upper body. Now, this is the big one down here, and we'll do this as a skill. If a resident has a weak side, so let's say the right arm didn't move, we're going to remove the clothing from the stronger arm first, and then when we're getting them redressed, we work up the weaker arm, and then they can help us get that shirt on. And we will do that that's one of your skills you have to do. Okay, main hints for getting people dressed is we're going to gather up the clothes because it's easier to guide them, get their foot through. If they're slacks, shirts are the same thing. If they're long sleeves, we try to gather it up. I have to say, one of the things, if you could get people to buy stretchy clothes when they need assistance, that makes it easier. Okay, and then always we're going to help put them away and wash your hands. Okay, so we have to do foot care. And we have to watch with people's feet because when they get infected, they could cause below the knee amputations because they get so infected. Now, that's not with everyone, but when you see amputations of older people, it's often because of some kind of infection. So they may require extra care. So we always have to look at the plan of care for everything we do. I'm not going to tell you that each time, but look at it each time. But one of the things I want you to do if you're working with people is to look at their feet every day. Your book does say bathe the feet daily. We don't always do that, I'll be honest with you, but we should if they're sleeping with their socks. Help them change their socks. Look at their feet. Um, they often, because of poor circulation, cannot feel if they have bruises, irritations, abrasions, blisters. They can't feel that. Okay, but when we're washing someone's foot, we're going to do one at a time. Always try to support any kind of joint. So while supporting the foot and the ankle, right? But we're going to wash between the toes. So make sure you wash between the toes and then dry between the toes. And then apply lotion to the top and bottom of the feet and you wipe away the excess, but do not put lotion between the toes. And then, of course, we're going to put on clean socks every day. And like I said, make sure the shoes fit properly and safe for walking, non-slip. And then we're going to check for blisters, sores, corns, infections, or swelling. Um, and smoking decreases blood flow, but so does just sometimes people as they get elderly, they have peripheral vascular disease. Okay, for fingernail care. Um, we're always going to check that we're allowed to do that because if even clipping the nails, if somebody is diabetic, if you clip too close and they bleed, they could get an infection, and their infections are very hard to care for. However, so never clip the nails before you check. However, you could always clean the nails, and so this is called an emesis basin. They also call it kidney basin. Emesis is when you throw up. Ugh. However, we never use it for that. It's too tiny. Anyway, but it's great for cleaning nails, right? So people could rest their hand in here. You could soak the nails. And then what we are allowed to do with the this is a orange stick, and with this bevel end, not the pointy end, but the bevel end, we could clean underneath the nails, okay? And then we could use a emery board to make sure that the nails don't have any sharp edges. Okay, next let's do mouth care, also known as oral care. Why do you do this? Well, poor mouth care can lead to cavities, gum disease, mouth infections, tooth loss, but it also could travel down to the heart. It could sit on the valves of the heart. This bacteria that's growing in your mouth. Also, they found with poor mouth care, there's a higher incidence of pneumonia because some of that that bacteria in your mouth, that's always there, but when it's in high quantities, if it slides back into and some of it gets in your lungs, it causes pneumonia. So at the least, oral care should be done in the morning and evenings and after meals if possible, but at least twice a day. Okay, so if people that need oral care more than at the minimum twice a day are those that are unconscious, which you may have at home, especially if you have hospice patients. NPO, that means nothing by mouth. That means they can't eat, and I'm going to write that in, nothing by mouth, so they can't have anything to eat or drink. If they have a nasogastric tube, which is a feeding tube, which is a tube that goes from the nose down the nose, often for feeding. If they're a mouth breather, like, or if they're getting oxygen by a face mask, um, if they're running a fever, they may need more oral care. Okay, so if a patient is unconscious, what we're going to do, and I'm going to pretend I'm unconscious, we want to make sure the head is elevated and turned to one side. So some of the things that we use, and then we'll go into regular oral care. These are toothets. I don't have glycerin swabs, but it's like a big Q-tip, but it has this glycerin on it and lemon taste, and so it's a little wet. With these are dry. These are called toothettes, but we're going to use them the same way. Put a little water, maybe some mouthwash in here. Then I'm going to wring it out on the side because it's spongy. Okay, it's a sponge. So I'm going to kind of wring it out. And the person has their head up in there. If I was the patient laying here, and then the nurse is the person with the purple gloves, always wearing gloves because we're touching saliva. I'm gonna kind of clean the teeth, get the mouth, if I could get them to open their mouth and kind of pull the fluid out. So this person probably isn't swallowing good. That's why we want it just moist. And we're actually trying to pull the saliva out. And then we'd always have a washcloth underneath. Okay. And then we could put lubricant, like Blistex on the lips. Okay, so if a patient is not unconscious and we just need to help them, let's say they're in bed or not in bed, we want to make sure that the patient is upright 70 to 90 degrees, okay? We will always put on gloves, and it's nice to have a clothing protector over them, so if they uh, when they spit out after they help them brush their teeth, put only a pea-size amount of toothpaste on the toothbrush. I don't have that. We're going to clean their mouth, and we're going to ask them to stick out their tongue, okay, and clean their tongue. Okay, and then we're going to hold this emesis basin. This is for someone who can't get out of bed. This is that kidney basin, emesis basin. We're going to give them some water to swish around and then spit in it. And then maybe a little bit more water. And we'll have to hold this for and put it right under her mouth. Spit in it. Okay. But one of the safety things is that they're 75 to 90 degrees high. Because otherwise that stuff could trickle down into their lungs too easily. Okay, next we'll do dental. So you're going to have to look at all the films because there's one on denture care, but I just want to show you. These are fake dentures, but you can see the tops. This is just the top, are very big. So, and it develops a suction when it's in the person's mouth. So to get them out, we may have to put our hands in and pop the suction. Other people, you could ask them to also do that when they hold their nose and blow. It'll loosen them up. However, it's funny, most people could take their dentures out themselves, but we have to make sure we don't break them. So if we're going to clean the dentures for them, we're going to line the sink with a towel or paper towels or fill it up with water. So if they slip and fall, they don't break. Okay. And these are the guidelines to, it's a CNA tested skill, but you can watch the film. Okay, one thing I do really want to emphasize as a caregiver is skincare. That's the most important, okay? So the skin or the integumentary system is really an organ, and that includes your skin, hairs, and nails. It's the largest body, I'm sorry, it's a system, um, and that the largest. Okay, and the last thing, it becomes very fragile. The skin becomes fragile and it gets thinner with age. And it tears very easily, very easily. So, what are the functions of the skin? It protects the other organs, but a big one, it provides a barrier to infection, right? So, any cuts or openings could get infected. It helps regulate the body temperature, it regulates fluid balance, it produces vitamin D. And by the way, people need a lot of vitamin D to have a good immune system to protect themselves against COVID. It helps store fats and vitamins, and you feel sensation, right? You can feel people touch you, cold, hot. And also it helps show emotions, right? We blush when we get nervous about things. How do we maintain that healthy skin? So we want to make sure that it stays, uh, that there's no pressure on it, right? And that it's not too wet, but it has enough moisture or lubrication because as we get older, our skin gets drier. Um, so what are we going to look for? I mean, you're the eyes and ears of whoever you're working under. So you want to see if there's any pain, irritation, bruising, or tearing, new growths, non-healing sores. However, sometimes people, especially in the feet, they can't feel those sores. So we have to inspect with our eyes um, to make sure that there's no corns, calluses, warts, fungal infections, ingrown toenails, blisters, or deformities. Okay, now and on skincare, one very important thing is that if someone can't move themselves, we need to reposition them every 2 hours. And sometimes they can, but they're sitting in a chair, and so we have to remind them to reposition themselves. Otherwise, the pressure could make holes in their skin called pressure sores or decubitus ulcers, old-fashioned name bed sores. Okay, so when someone's in a wheelchair, you want to move them even more every hour or so, right? Um, and just always check if there's special instructions for that. Um, okay, skincare. So one of the things for moisture control in the peri area is to keep the skin clean and dry. And that's going to be if they're wearing briefs, make sure you have their undergarments changed frequently if they're getting them wet, and schedule toileting, provide privacy. Um, One thing we want to prevent is friction, right? Rubbing two surfaces together. And it could be skin to skin or skin to bedding. So always be gentle. Try to lubricate the skin where there's skin to skin contact, right? So here underneath the breast, in the man by his scrotum, and never drag the person in the bed. So we don't want to drag, we want to pick them up with a pull sheet, but try to pick up the pull sheet so we're not just pulling the skin against the sheets. So there's different names for this. Shearing is kind of the combination of pressure and friction. So it usually occurs when the head of the bed is up, and that's a semi-Fowler's, and they slide to the foot of the bed, right? So the shearing kind of bends and closes the blood vessels, which leads to tissue death. And you could think of it as like getting a wedgie on your skin, right? If I start to slide down in my pants here where my skin, I would start to push my tailbone into my skin. So we can prevent that by putting the head flat at least some of the time. We could use different kind of soft things like they call sheepskin or heel protectors. But what we want to do is make sure that we roll the patient, don't slide them like when we're changing linen. Okay. And so here's the common pressure areas. So it's where any bones stick out, right? So the back of the head, the shoulder blades, the coccyx, the heels. So the biggest ones that I have seen, honestly, are the heels, get pressure sores, and the coccyx or the tailbone. It could also be when someone's laying on their side. It could have the ankle bone, the hip bone, the pelvis, but the biggest one that I've seen is usually the coccyx and heels. Okay. So there are 4 stages of pressure ulcers. Um, and I'll show you pictures in a bit, but the first one is what we're looking for because the skin is just, if it's a Caucasian person, they may turn red, pink, or even darker. If it's a dark skinned person, it usually turns darker. However, any change in skin color, because there's different stages and it could be a grayish, more of a grayish color. If that discoloration doesn't fade within 15 minutes after you turn the person to get them off that area that's discolored, then that's a stage 1 pressure sore. A stage 2 is when the skin actually breaks open. A stage 3 is the skin breaks down and you could see it's a little bit deeper and you're going to see exposed areas. And I have some pictures and when it's a stage 4, it's all the way to the muscle or bone. Okay, here is a stage 1 where it's just red. Here's a stage 2 and you could see it broke down, but it's not very deep compared to stage 3 where it's deeper, and stage 4, it's even deeper. Okay. Okay, here's the pressure ulcer of someone's heel, I think it is, right? And right here you see how it's broken down. This yellow stuff is needs to be debrided or taken away because it's just bacteria growing on there. It should be nice and pink to be able to heal. And so you could see it's really hard to heal these things up. So we want to make sure it's pressure is one of the biggest things that we can do. Um, Okay, this is, I want to show you some pictures. There's some heels, right? And that they're actually cutting off the dead skin. That doesn't hurt because it's dead. Here's another picture of a pressure ulcer. And you can see it's not even attached under here. They call that undermining. Okay, this is definitely a infected one. This is necrotic. It's dead, but it's also infected. Okay, let's just talk about getting someone comfortable. Um, Sometimes it's just the simple things of if someone's uncomfortable, let them tell you, but then you need to communicate it to your supervisor so they could communicate it to someone who might come up with an answer. And maybe it takes a village, right, to figure it out. However, sometimes it's just repositioning someone to make them more comfortable. It could be someone who has, and then if there's people that have insomnia that are difficulty sleeping, we need to report that too because that lowers their pain threshold, and maybe there's something they can do for that. I love back rubs. Old school, you don't have to be a masseuse just when way back in the day, we had to give back rubs to every patient in the hospital before they, if you were working the PM shift. And honestly, it's just relieves tension. It does increase circulation, but it just is soothing, right? So we always have to make sure that we could give them a back rub. But you get to know your patients or your clients, and most people definitely could have back rubs. Um, Okay, so like for anything else, and again, you don't have to be a masseuse. You could Google things, but you're going to wash your hands. And if you want to wear gloves, you could wear gloves. Just put lotion on the gloves. You'd be surprised. It's okay. And then rub, 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 right? You put some, you warm up the lotion with your hands. And I like long strokes, but it doesn't matter whatever the patient wants. Just get your hands on their back. Circular motions usually do work good. And mostly it's do it. Don't worry if it's perfect. Um, okay, if you could do it for 4 to 6 minutes, they will love you. And then if there was lotion, you could kind of pat the lotion away, but usually it's rubbed in, so you don't need a towel. Okay, last thing we're going to do is using different ways to go to the bathroom. We're going to use bedpans. Um, and here's a regular bedpan, right? And you could use it for urination and bowel movements for women. For men, they may just use it for a bowel movement, but they may use it for urination. They have a urinal that they could use, though, and I'll show you that later. Um, there are other bedpans here. Make this a little bit bigger. Okay, this is called a fracture pan. It's an orthopedic pan. People with fractures think fracture legs, and but some people find it more comfortable. You would hold it at this end, and this goes under their behind, under their buttocks, right? So it looks kind of weird, but the high end always goes towards the front. But they're pretty comfortable and they work well, and they don't leak for the most part. Okay. And then for men, they could use a urinal like this to urinate in. You take the cap off and they stick their penis in there, and then they'd have to spread their legs apart, but they could, if they're sitting in the bed, but they could urinate in there. Okay. So there is a video for using for giving the bedpan. So I'm going to let you watch that. One thing to make sure is, of course, you wear gloves. And once you give them the bedpan, you're going to take those gloves off, wash your hands, and then put gloves on because usually they want to sit on it for a little while. Once they're on the bed, you put them on when they're flat. But once they're on the bedpan, we want to get the head up. People are going to have a better bowel movement if they're sitting upright in bed. And there's a video for you to watch. Then there's bedside commodes, and those are like little porta potties that we can put at the side of the bed. And I will show you pictures of the bedside. Okay, this is a bedside commode. So this bucket comes out once they've urinated or defecated. It also could come out and you could put this over a toilet. It could go get higher. And this way someone has arm rails to hold onto as they're sitting. Okay, lastly, I wanted to show you some bathing devices, which I forgot to do earlier. So this could go in a shower, right? It's just a chair. This is for someone who really can't stand and can't move at all, that we could pull this back and you could shower them right in this chair. Um, then these are for bathtubs. So if people have bathtubs, they could slide across and at least put their feet in, and then they often will install a handheld shower. And this one is very common in facilities because people could sit on it and you could roll them into a flat shower. So that's called a shower chair. And that is it with the shower chair.